All right, good morning. It is 11:03 a.m. Today is January 26th, 2024, and this is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. We've got 56 folks on so far, and so we will start off doing our introductions. I am John Decker, the Director of Community Services at Alta California Regional Center. I'll go through and introduce some of our staff from community services and management. So I see Shauna on and Belinda and Beverly. Good morning. And Jolana and Kylie, good morning. And let's see, I see Christy Owasa, good morning. And from management, I see Carol Wilhelm, good morning. And our lead community services specialist, Jason, is here. Good morning. And our employment specialist, Carly's on, and Dan Kilmer is on, and Gary is on. We've got Associate Client Services Director Tracy Brown on this morning. Good morning. And I see our housing specialist Rhonda here as well. I see Elijah. Good morning. And my assistant Zach and Ethan as well from Community Services. And Leah is here too. I'll be talking about ILS in a little bit. So Leah's ears will perk up, but I don't think I'm going to call on her. All right. So thank you everyone for joining us today for our agenda. We've got, I don't know, I had a small list and then it got longer as we met with accounting this morning. So updates on arm rates. I think Jason's going to mention about the spotlight. We don't have a spotlight today, to my understanding. We're going to talk a little bit about ICF funding. I don't think we have a ton of ICF providers on here, but just give you a heads up about some information that's going to be coming out from the regional center about intermediate care facilities. We are going to talk about the HCBS animation project, which is a statewide HCBS project that is now featured on ARCA's website. And so I'm going to share folks information about that. Michelle is going to give us another positive update about the DSP stipends. We are going to be talking about the ILS rate implementation, and so that's why I mentioned Leah and Isabella. So we'll talk about that. DSP payments for the stipend, DSP payments for the surveys. We're going to talk about. Oh, I don't know. Let's see if I've got Faye or Jennifer on here. Oh, I don't know if I do. If I end up with Faye or Jennifer on here, I will talk about our new managers that we just are talking about here at our regional center. And let's see, we have supported living forum coming up. Carly, I think, is the job fair flyer done? Can we share, folks, the job fair flyer?
Yeah, we can share it if you're okay with me sharing the draft that I sent you.
I think that this is the meeting where I'm just going to approve all of your work, Carly, so that we can push it out to our service providers. So yes, I believe when I looked at the draft, it was fine. So let's share that with folks so that we'll talk about that as well. Our upcoming job flyer for our Yuba City Job Fair. Promoting our community meetings. We had a board meeting last night, and so we're going to talk about the upcoming community meetings. We're going to talk again about Valentine's Day, and then we've got more vendor forums coming up, day in employment, and then some more things that came out during our board meeting last night. So my goodness, quite a bit then for today. If there's anything else, and I don't know, I had to leave the board meeting about 5:45. Steve Andrews, did you hang all the way to the end? Did you make it to the end of the board meeting last night?
I left at 5:30 myself.
Good. Okay. Yeah, it was a lengthy one. Oh, and then Carol,
Excuse me, John.
or Carol,
Is the actual audit going to be posted on the website, Alta Regional's website?
Yeah, I believe it is actually. I think Iqbal mentioned that yesterday. If it's not, they'll post it where they have all the other audits. I believe it's in the transparency section.
Okay.
But let me verify that. And if not, then we'll double check on it next week for you. But I know that Iqbal mentioned yesterday, and my recollection is that's typically where they put the audits. Which I will mention the audit. Thank you. I forgot to mention that, Steve. So I'm going to add that to my list of agenda items then. So for the arm rates, we met with accounting and just wanted to share any of the residential providers that are on here, the arm rates have all been updated. We had to shut our system down briefly so we could update all of them, but the alternative residential model, the arm rate facilities have had their rates updated. If there are issues when you go to bill next week, when you see your billing, please reach out to your fiscal assistant for anyone as it relates to arm rates. All right. So Jason, I think we're not spotlighting anyone right this week.
Yeah, we're not spotlighting anyone this week, but next week on February 2nd, we'll be spotlighting Hannah Interpreting Services.
Perfect. I think I saw them added to the invitation for the meeting this week, so that's awesome. Perfect. Um, all right, and please, please don't hesitate to reach out to us. Jason, are you going to be our point of contact for future spotlights, or
Yes,
has Michelle
I'll be
passed
the
that one on?
I'll be the main point of contact. I'm gonna go ahead and put my email in the chat right now. So if you would like your business to be spotlighted, I will go ahead and get you scheduled for the next Coffee with Community Services.
Again, folks, when we do our introductions here, we have a number. Oh, I see Daisy down there from Hannah. Check it out. All right, next week, Daisy. Um, so we have a lot of, not only do we have our community services staff that are here that may be familiar with your, services. We don't really. Whoops, sorry. Oh, my phone is trying to answer a call right now. I don't want that to happen. And we also have a lot of managers. We have some service coordinators that log into this call as well. So it's just a good opportunity for you. We do those vendor fairs where you can come in and meet people in person, and we love it when providers do that. But this is also just a great opportunity for you to, be a little bit more connected with our staff. So Jason's going to put his email in the chat, right? So that, yep, perfect. That is in there. And then Carly, I got the message that I think that's Carol Wattillo is going to do an update on Acre as well. Um, all right, so the next thing I wanted to share real quickly, and I'm not going to get into it too deep because we don't have a lot of intermediate care facility providers that are here, but there is the switch that is going on for people that reside in our intermediate care facilities. All right, let's see. Are you guys seeing DDS's directives page? Yeah? All right, perfect. So one of the things that just came out is a little follow-up. So we have the transformation or the crossover from fee-for-service Medi-Cal for our clients that are in the intermediate care facilities over to the managed care companies. And there is a provision that allows service providers to build a regional center if there is a lag in the funding that they receive from that. And so I thought this came out a while ago, but this just came out this week. And so I was thinking about the one from November. So there's a directive on here. So just know as our regional center goes, we're going to be sending out to all of the ICF providers the information from here, how to do the lag funding agreement, how to do the attestation of form. And then we met with accounting this morning and we worked. So for any of you facility liaisons or managers that work with the ICFs, you'll be seeing that we're adding a new rate onto all of the ICFs so that if this does come up, that we don't have to wait and to vendor it and get it updated. Immediately, we should be able to be responsive to service providers if they are making a request for lag funding. So we're working that out with Robin LeMay right now in accounting. Our vendor coordinators will be submitting an update to accounting, adding all of those lag funding rates to that. Additionally, and again, we don't have a lot of ARFPISHN providers, and we know there's no group PISHN providers yet, but there is additional information on DDS's website related to a directive for nursing policies and procedures and competency training. And so Jordan and her team primarily work with those service providers. But I will say, because it did come up last night during our board meeting, that we did get our contract approved for our service provider for Alta's first group home for children with special healthcare needs. And that's pretty cool. Those facilities allow us to not have to move our kids into like a subacute home that is, or a subacute facility that's hundreds of miles away from their family members, but instead allows people to remain in their home community and receive that additional medical support while they are, a child, but not lose that proximity to their community and to their families. So very excited about that one moving forward. Our board did approve that one last night. All right, I'm going to stop sharing my screen real quickly, and I am going to actually go to ARCA's website. And 1 second here. Getting so many messages right now. So we're going to put a little do not disturb on right here. Okay, very good. So I'm going to share my screen. This is the Association of Regional Center Agencies. We also last night had the ratification or the approval of the regional centers contract with the Association of Regional Center Agencies. There's 21 regional centers, many of you are aware, in the state of California, and all of us work together, share best practices through the Association of Regional Center Agencies. There is discipline groups within the Association of Regional Center Agencies. So for example, there's a director of community services, directors of clinical services, directors of case management services. And then also the chief financial officers like Iqbal. And so that's one thing that we really appreciate at our regional center, is being able to have, 20 other regional centers that we can rely on for support and best practices and innovations too. So with that, we have all gotten together, which is a rarity for 21 regional centers, to support, and I'll drop this into the chat real quick, which is the site for ARCA. But we've gotten together to support the HCBS animation project that Tri-Counties Regional Center is doing. And I hope you'll take some time to take a look at it and check out the videos. They're all posted right now on the Tri-Counties Regional Center's YouTube page, and is available for everyone. But just it's a great opportunity to see really kind of like Hollywood level production skills put into HCBS trainings. And so our regional center was very happy to be able to support this. And one of the reasons, or one of the ways in which we supported this, is that all of our languages that are our threshold languages for our regional center, the HCBS materials are available. And these trainings are not just trainings for service providers to ensure that they are in compliance with the HCBS, but also for clients as well, specifically so that they fully understand what they should be seeing as far as HCBS within the homes. So we're very excited, or not just the homes, but inside their services. So very excited to support that animation project. I won't share the video right now, but the videos are pretty cool. And, we'll talk more with you as, how we feel like we want to promote you utilizing these with your staff, and possibly looking at how we might utilize it and share it with clients. But again, it's a huge statewide project, and we're very pleased that Tri-Counties took the lead on that. All righty. I'm going to do DSP stipend stuff with Michelle. And then if Carol is on, then I'm going to call on Carol to talk about acre stuff after that. So if I can go to Michelle Duchesne, please, for an update on the DSP stipends.
Yeah, good morning. I'm sorry for my tardiness. I actually just came out of a brief meeting regarding the DSP stipend with some more, a few updates. So my team will provide you guys with some more information as we get what was requested. But currently, when we get our reports from DDS, we're not able to change or edit any information. So if a DSP inserts the wrong vendor number or the wrong regional center, unfortunately, we were not able to edit that. So now the department is coming up with a ticket that we can submit with a screenshot and requesting that those be changed as we find those. So we'll get a little bit further information on that. They also just wanted us to share as well that DSP's trainings are not complete until they receive the certification. A lot of times we have DSPs that are completing, they say, I've done the second one. Unfortunately, the completion requires for them to complete the feedback feature. And also several of the trainings have a 10-minute quiz on it. So if they do the training and they don't get the certificate, have them check that feedback button and the quiz. So we have asked for a screenshot of what those are so we can share those with you, and our Belinda and Raven can share with our team as well. And so that's kind of our updates. I'll get that more to you as we receive it. John, am I able to share I can't share my screen yet. I was going to show the numbers for this week.
We have to be able to share the numbers. So you're now co-host.
All right. Are you seeing the numbers?
I am seeing it perfect. It looks perfect. Yeah.
Perfect. So according to the 23rd of this month, it looks like we have a total of 40,613 total DSPs registered for the state. And if you go down to our numbers, it looks like Alta California Regional Center is still at the top as far as the most DSPs that have completed the training. Last week, we went up from this week about 5.8%, which is an additional 229 trainings, which puts us at a total of 7,421 full trainings for our area. And that's it. That's all I have to share.
Best trained DSPs in the state. Again, what I was pointing out when we were going over the numbers this morning is that not only like are we still, we're about 800 more than any of the closest regional centers that are much larger than we are, but we're still having a high percentage of new people that are doing it. Like we're still, even though we've had so many people that already have done it, we still have, we're at 5.8%, which is still like even like among the top with the regional centers for that as well. So again, it's just speaks to, I think I mentioned before, there are so many DSPs that would be eligible for this. There are literally tens of thousands of more DSPs that could do this training. It's just making sure that the word is out there and that we are promoting it and getting it done. So far, as I just carrying on from last week about how awesome you all are as service providers, you are getting it done better than any other regional center in the state. And so kudos again to you as service providers. And kudos to our staff that are having to process all of these payments and getting everything out to all of the service providers. I know that people have asked us for more information, broken down information. There is a huge volume of these that are coming in, and we really are going to rely on you connecting with your like actual staff that are participating in the trainings and the ones that have like signed off saying that they did that for some of the specific questions that you have. Because again, when you're dealing with the volume of requests that we have for payment, us being able to provide individually track down information for every provider is beyond our capacity in order to be able to process the payments within the time frame that we need to. Um, again, I like I said, I can't say enough. You guys are rocking it out, and please just continue to promote it to more and more staff that you possibly can.
John, I forgot to mention too, when meeting with accounting this morning, they will issue the next wave of payments in the next couple weeks. They're pulling together all the final ones they can.
Yes, so we're going to be doing the payments. Two runs of payments here are going to be coming out. One is that that run for these DSP stipends, and then last week again I shared how we had a bunch of service providers that had also participated in the DSP surveys, the ones where you get the $8,000, and I think I showed the list of like 12. I think it was mostly residential service providers, but we're also cutting those checks in the next couple of weeks as well and getting those out for those payments. So again, kudos to you all that are participating in all of these, and kudos to our accounting department and vendor coordinators that are getting all these payments out and processed and as well. All right. Let's see. I wanted to jump over to Carol Botello if she's available.
Hi,
Let's see.
thanks, John.
All right, let me make you a co-host. Can I make you a co-host real quick? Okay.
Oh, sure.
You have the power.
Okay, well, I just actually put the flyer in the chat, so yeah, people can just pull that up on their own. So we have we received a grant through DDS to create a curriculum for ACRE in customized employment. So we are now getting ready to do that training. It's coming up here in February. It's February 12th, 13th, and 14th, and the 29th and 1st of March. It's 5 days, it's 40 hours worth of training that you will receive free. In addition to that, we will have the employment specialist who take that training, identify an individual that they serve, and we will mentor them through the process of discovery with those individuals, hopefully leading to those individuals finding customized employment jobs. So it's that mentoring through Griffin Hammis is usually over $1,000 per person. So it's in addition to the 40-hour training. So it's a good deal. It's free. Yeah, just if you are interested, if you want more information, you can reach out to me. I'll put my email in the chat as well, but also on the flyer, Kate's email is on there, and you can get more information that way. That's all I got.
Awesome. Thank you very much for that. That's great. All right. We mentioned last week that the ILS rates for the rate increases are being inputted, and that billing will begin when you guys do your billing next week. Oh, thank you. And Carol put her email there in the chat too. When you begin billing next week, you should be able to see what your new rates are. And my understanding is that if between now and then you just can't wait and you want to verify that what you see in your billing is your actual rate, that you can reach out to Leah and Isabella, because we don't know who's necessarily assigned to which ILS provider. And they have a copy, or at least Leah has a copy, and she can share it with Isabella of what your guys' new rates are going to be for the ILS providers. Again, next week when you go to do your billing, you should be able to see those updated rates. Well, the end of next week, I guess. Any questions about that for ILS providers? Oh, and thank you very much. Isabella put her email in the chat there, and if Leah could do that as well, that would be great. And the DSP payments are done. DSP stipend. All right. Let's see here. Let me go. What I wanted to share was, and we'll put out a notice for this. So we last week, I believe we talked about our community placement plan, and I kind of went over what was approved through our community placement plan and community resource development plan through the Department of Developmental Services. We get this special funding every year, and for those that are newer to this, we put together requests for proposals, and then we hold a vendor orientation, or a RFP orientation, excuse me, or a bidders conference as they're called sometimes. And then we will receive the applications, we will review the applications or the proposals, and then we'll schedule meetings, do interviews, and do our awards. And this process, we never know when it's going to start and when it's going to, well, we know when it ends, which is June 30th, but we never necessarily know when it's going to start, because we never know when DDS is going to give us our approvals. One thing that we know is that within 45 days of when we've received the approvals, we have to be able to post our RFP. I believe that we are planning on getting our RFP out early next week. I think they've been working on updating the language in that. And so we're going to be putting the RFP out. And what we decided to, we have last week you guys would have heard that we had a variety of different types of things that we are looking at doing. And so this year, because we really want also so many of you possibly to be interested in applying for these, is that we're going to do our RFP orientation during Coffee with Community Services. So we will do a special advertisement for it. It's going to be the February 23rd Coffee with Community Services session. And our plan is, usually the RFP orientations to learn about the new projects that we're doing, sometimes it goes over an hour. And so what the plan is we'll do, the presentation going over how to respond to one of the RFPs that the regional center does. And then a little bit more specifics about the proposals. And then we'll cut the recording off at noon. And then if anyone wants to stay on and talk with like the specialists and ask questions after 12, then we'll keep the room open so that we can do that. And that again will be on February 23rd of 2024. And it'll be on that Friday. The question is, can we record it and send the link? Yeah. So the nice thing is that it's going to be recorded with Coffee with Community Services, because we're doing it during Coffee with Community Services. So it'll go on YouTube. Thalia typically gets things posted within a week or two. That's why I always do this at the beginning of my videos, so that she knows when to start recording. All right, so let's see here. And I'm saying hi to you guys too at the same time. And then the proposals, just to give you an idea about that, the proposals, we're looking at having those due around March 20th. And then doing our interviews in the interim with a final selection by April 10th. That would then give us enough time to be able to get into contract with folks by the June 30th deadline. So the idea is they give us quite a bit of money this year because we had 2 housing projects that were attached, but for, I think it's like almost $3 million worth of projects, the staff need to get into contract by June 30th. So that we get all the funds encumbered. So more about that, about the CPP, CRDP stuff, we're going to send it out via MailChimp with the descriptions of all the different projects that we're planning on doing. And then you will learn more about that in depth when we actually have our Coffee with Community Services session on February 23rd, which is also going to double as our recorded RFP orientation. And so that will work out nicely. This is the benefits of having a weekly service provider meeting, is that we can throw things in like this, and also hopefully expose more people to applying for RFPs for us, because sometimes we get like the same applicants that will come through and do them, and we again have different things like the respite center, right? Like that's a very different type of thing that we've done with our vendorizations. And so be excited do that during that. Let's see. Let me go to our, let's see. Oh, let me check the chat. Any questions about that? Nope. All right. Perfect. So upcoming events that we have, I'm going to jump over to our calendar for Alta here. And I'm going to share my screen. And I'll kind of prep Carly if you want to get your flyer kind of ready to go. And when we get through the events here, we'll have you share your screen and talk about our upcoming event, which you guys know we like to heavily remind you guys about these things. That's how we get such great turnout. All right, so events and calendar. Again, I really appreciate the work that goes into making sure that we have a very updated calendar, and we're able to put a lot more community events on there. And this has been a long time discussion and request of the regional center is for us to have a better events calendar. So shout out to our staff that are keeping this updated, and I know we try to load in as much as we can. So we have coming up on January 28th, which is Superfest, a Developmental Disability Film Festival. And that will be coming up. That's January 28th from 3 to 6 o'clock, and they're doing it via Zoom. So please make sure that you don't wait. There's advanced registration that is required for that. And let's see, we've got our upcoming SLS Services Vendor Forum. I think we are going to be talking about billing a little bit in there. I think there were some questions that came up from our SLS providers related to billing and payments and things like that. And so we're going to have a little discussion about that one in there. Upcoming, and this was an announcement from our board meeting as well, is that Alta is going to begin hosting quarterly community meetings. And these quarterly community meetings are going to be held February 7th, May 1st, August 7th, November 6th, and it's going to be from 11 to 12. With that, there will be opportunities for each of us from Alta's executive management team, the clinical folks, the case management folks, myself to share some things during that meeting. And so I know I will have some agenda items, as will the others. Certainly looking forward to being able to have a richer and ongoing connection with our entire community. It's great getting to meet with service providers every single week. And I feel like that really enriches us as a regional center because we get to hear directly from you and be able to share with you directly what we know about all the changes that are going on. And so, again, looking forward to this. The flyers located in multiple languages there. Please share it. Let folks know that ASL and Spanish interpretation is available. And for those that need that, please reach out to Shamir as well. And that his contact information is right there too. Alrighty, thank you very much for that one. Let's see, we've got, again, some other upcoming activities. We've got a day in Adult Vendor Forum, Lunar New Year Festival, Valentine's Day Mingle and Munchies. Excuse me. We do have town hall meetings that are coming up. The town hall meetings that we are doing, these are, and maybe we should write down that these are Yolo County town hall meetings, but these town hall meetings were initiated because of our kind of coordinated future planning initiative that we have at our regional center, where we're really looking at aging caregivers that have their, adult children that reside with them. And the Board of Supervisors in Yolo County is very concerned about the support needs of the caregivers of adults with developmental disabilities and children with developmental disabilities in Yolo County. So with that, Supervisor Provenza, who leads the Aging and Adult Services Subcommittee for the Board of Supervisors, has initiated these community meetings. And we did 3 last year, and then we've got these 4 that are scheduled here upcoming, and it's great. We've been to Davis, we've been to Woodland, we've got upcoming in West Sacramento, Winters, in the new community center in Esparto. And so I was talking to Veronica and Catherine, our 2 managers out of that office, and certainly just want to encourage, it's very frustrating for caregivers. Our service coordinators are really attuned with this, and certainly many of you service providers are as well. And having a venue to be able to talk about what you need, to be able to connect with your elected representatives, and to have Michelle Johnson, our director of client services, and myself, and probably at least one of our managers present. I feel, and Veronica's been there before, I feel like the meetings are very positive. Like, I feel like we always find actionable things that come out of the feedback that we get from the community for it. And so I'm really pleased that Yolo County has continued to put this on. And I would just share that Herman on our end also does a lot of support, Herman Kothi, to make sure that these meetings can happen. And being able to set up live interpreters is not an easy thing. But the way that we're going to be doing this is, for the first 3 meetings, they'll be in person. There will not be a hybrid option. It'll be, and then the last one will just be a virtual meeting as well. So we did the first ones hybrid, but a lot of richness from meeting with people directly, and that's why we're visiting every single community basically in Yolo County. So that is coming up, and we've got those throughout the month, throughout the upcoming through the end of the fiscal year. Actually, we have the early start job fair as well, that's coming up. And again, this is one of those things that we've put on at our regional center because we really want to support our early start providers and ensuring that they have all of the staff that they need to be able to provide the supports for our clients. We had an excellent presentation last evening at our board from a mom who talked about the benefit of the services that she's received from her son. And it's not often where we get clients and families that show up and give kind of testimony and talk to our board directly, sit up at the table in the meeting, and especially since COVID, I don't think that we've had that level of presentation, and it was fantastic. And just really spoke to the work that's done by our service coordinator staff, and really the necessity for more and more service providers. Camellia has been in here and has talked about how our intake numbers have continued to grow so much. We did a lot this last year to try to support the early start service providers by doing the 637 request. To be able to get the 637 request is where we asked with the public meetings, and we asked to be able to basically increase the rates of all of our early start providers because of the challenges that we were having in getting services, and especially in-person services. And again, the mom last night really spoke to that and talked about the impact of it on families and children of not being able to initiate those services fast. And so for us, I just appreciate that Alta has made it so important to support the hiring needs of our service providers, because as Lori said last night, like, the providers are the ones that do the work. They're the ones that are working with the clients day in and day out. And if you don't have the staff to be able to do it, we're not going to see the outcomes that we're hoping for people. We can't concurrently be trying to bring in so many new people into the system and not also really be supporting service providers as it relates to hiring and rates as well. So this will be coming up. I know that broadly a message went out yesterday to share information on people's social media as well about the early start job fair. And so I just, anyone that you think might be interested in this, we really want to encourage them to come in. All right. And again, we'll get into more of some of these other events as we get later into the year, but those are kind of the ones that are upcoming the soonest. I'm going to stop sharing my screen real quickly. I'm going to make Carly a co-host. And Carly, you can let me know whenever you're able to share your screen. And once again, I know we talk about these DICE job fairs, these disability industry career expos, the DSP collaborative stuff. Carly plays a huge leadership role in making sure that all of these things happen. And so I'm going to throw it to her to talk about our upcoming one.
Thanks, John. So our next Disability Industry Career Expo, DICE, is going to be on April 23rd. This one is going to be at the Sutter One Stop out in Yuba City. So any providers who serve that Yuba City, Sutter, Marysville area, a great event for you guys to come and look for some DSPs. We are collaborating with Sutter One Stop. They are sharing the job seeker flyers for to everyone that they work with. So we're expecting a great turnout. It's also going to be right next to their main office, and we scheduled it for a time that they have classes and that students are going to be coming and going. So we are expecting some heavy traffic. So this should be a great event. And this flyer will be going out in a mass email to everyone. You can click this link here, or you can scan the QR code. You can scan it now and sign up while I have it up. So again, the Sutter One Stop has been a great partner with this. So we really want to give a shout out to them. They're going to be doing a lot of the footwork with getting some job seekers there. So our past events have been pretty successful, good turnouts. We're learning from each of them, kind of what we need to do to make the next one better. So yeah, April 23rd, 10 a.m. to 2 p.m. And I'll put this in the chat. And then while I have the floor, I also want to remind everyone, if you attended the the Sierra College job fair last week, a survey went out. It it went out to the email that was used to sign up. So if it didn't come to your email directly, it may have gone to like an HR email or someone else, whoever it was that signed up. I'm going to put that in the chat as well. Just please remember to fill that out. Getting that feedback really helps us learn how we can improve the future DICE events.
Yeah, sorry, folks. Like, this is the cost of doing business. We don't charge for the website. We don't charge for attending the job fairs or any of that type of stuff. We're putting lots of staff hours and lots of funding into doing this, but we really need the help in you responding back to the surveys. And it's tough for us because I would need, I need Carly and Gary out doing all their other things, and tracking down responses from folks is not fun. And so if you would not mind, let's get those responses back in, because we want to offer the job fairs that are the most effective for folks as possible too. And let's see. There was a discussion, sorry, real quickly, I had mentioned about the audit with our board meeting last night. So we did receive our independent audit. The way it works at regional centers is that we have to have different companies that do our audits after like a certain period of time. Regional centers are required to do that. We spend $700 million or so on services for clients. On top of that, there's probably another 100 million that goes into the operations of the agency. We've got over 700 employees, about over 30,000 that we're serving now as far as clients. Lots of different funding type of things that go on, and making sure that we are in compliance. And once again, I just appreciate being in our board meetings and hearing these independent auditors saying that our fiscal practices are sound, that the fiscal strength of our agency is strong, that we don't have issues as it relates to accounting. And again, I just what was nice is that the person that came back to do our audit, because we have to switch auditors, has not done our audit, and since we were a much smaller agency, which was only 5 years ago, but we've grown quite a bit, I guess, since then. And so nice to hear the compliments as well from the independent auditor about the fiscal practices that he was observing within our agency too. In the board meeting last night, and I really appreciated it, Lori took quite a bit of time to be able to provide a kind of a year in review update. Those of you that saw the newsletter that went out would have seen the community services numbers that we put out there, so that you can be aware of how our growth is. But it was great to be able to hear updates all across the agency, amongst case management, amongst our federal programs, amongst clinical, fiscal, HR, and again, with just a very large growth of our agency, and lots of moving parts. I think as staff, and certainly you as service providers, and the work that you are doing, there's a whole lot to be proud of. And so it was very nice to hear Lori last night talk about the implementation. And one of the things that we specifically talked about was doing these 637 requests to really support service providers to get higher rates. There was an update that was given from our CAC and PAC representatives. Gary gave the discussion last night. Would not necessarily be any big surprises for folks that are here. One of the things that we just talked about was that there is basically across the board, folks have a level of concern as it relates to the extension of the implementation of the rate study. I think I mentioned last week that the Association of Regional Center Agencies had come out specifically stating that they are, in support of the rate study being implemented. And I also passed on the message from Lori Benalis last week from Nancy Bargeman, the director of DDS, which is the regional center is to act as if we are fully implementing the rate study at the end of the fiscal year, which means we need to, in essence, prepare ourselves and put all the activities in place, both on the community services side and on the accounting side, so that the full implementation of the rate study happens on July 1. So we will wait and see. As I showed the folks last week, we have and I talked with my staff about this week during our all CSS meeting. We're very early in that budget process. We've got to get all the way through to next June before things get finalized. And this is a good place, I think, to organize some of those discussions about the concerns related to the budget. And certainly we were referring people to our PAC meeting for those discussions too. Eric, yes, please go ahead.
Um, just a really simple question because we could talk about this for a long time. Um, when DDS says that prepare for the full implementation of the rate study, how would that apply to the QIP program, which they don't have, that it was going to be the vendor portal that was going to allow providers to get the last 10% of your rate. So under the rate study, you're only guaranteed 90%. The last 10% is based on performance. So when DDS says let's plan that it's being implemented, but they don't have QIP, what would happen if the rate study is fully implemented, but we don't have QIP measures? Is there any, is that being talked about? Is there a backup plan for that?
Well, if that happens between, let's say, the months of April and June, the level of gray hair in my beard will get a lot worse. Because how are we going to do all of this if we don't know the quality incentive measures, right? So that's the deal. I do want to provide some clarification that I got from Ernie Cruz and from Aaron Christian related to the provider directory. And also, we got a new message about the provider directory this week that I can share with folks. So first, one thing is there was a discussion and I don't remember if we talked about this yet, at our last provider advisory committee related to the provider directory, and that it was pulled out of the quality incentive program like before Christmas. In discussions with both Ernie and with Aaron, it looks like it will still be a component of it, but they are working out what the incentive is going to be in order to get providers to be able to do it. Because right now the incentive was that's their low hanging fruit for your 10%. If that goes away, you know, we have to get compliance from all of this as well during the time frame. And so that's going to be one of the challenges, is that if we can't articulate what the benefit is of providers to doing this, if they're not required to doing it, it's a lot of providers. We're talking about, 1,000 of you guys that just bill us every month. There's 21 regional centers. It's a lot of people to get into this directory without that. So I've heard that that directory will still possibly be a component of it, but you're right. They are looking at now. I mean, that's one of their things, right? We can postpone the rate study implementation. We're saving, $1 billion, and it's going to give us more opportunities to be able to better define some of the quality incentive things. The question came up from Lindsay too. Well, what about the service code crosswalk? What about, how is Jason going to figure out how we're going to categorize these the service providers, right? And what's the impact going to be related to that? We also don't have that either. I know I mentioned that last week as well. I will tell you, I did ask Lori to actually follow up. I'm inviting Jim Knight to come to our community services directors meeting next month at Alta, so that I can get Jim and or at least Ernie or Yasser kind of nailed down on because the service code crosswalk to me is like one of the biggest things. Like for the quality incentive stuff, honestly, that impacts every single vendor in the entire state, and they have to figure that out and put that in writing to you guys. But the service code crosswalks could come out, and if it comes out too late in the fiscal year, it's going to really, they're still going to expect that it's done if it has to get done. And then if we're going to be fully implementing the rate study July 1, and it's just going to put an immense amount of pressure on our specialists and on our vendor coordinators and everyone. So yeah, Lindsay, I think that was the comment that we don't have that yet either, but it is act as if. And so that is what we're doing, whatever that means for right now. In the meantime, we're waiting on additional guidance from the department, but we are not supposed to kind of, in essence, put ourselves in the mode of just think that this is not going to happen, because there's a lot that goes on between now and July was the message. So any other questions about that? I wanted to share, and I know Eric asked for it last week, the ARCA budget position. They haven't put it on their website yet, and I haven't seen it get sent out widely via email. I'll try to send that out, but again, I think I've kind of verbally gone over the high points, and the big thing is that it is a budget priority for the Association of Regional Center Agencies and the member regional centers that the rate study be implemented, and that also the rate study keep up with inflation and allow for rate increases when the costs are increased, and that they built this huge rate study. They should be able to figure out how to give people rate increases when you have salaries that go up, for example, or insurance costs that go up, now that we've got the rate study agreed upon. So that is what I think I have about the rate study stuff. About the directory, we're on the cusp, I think, Michelle, right, of it coming to fruition here. Michelle and I got interviewed a couple weeks ago by some contractors from DDS to talk about what the impact at our regional center is going to be for the it's in essence like the validation activities that are going on. Like they're going to dump all of the vendor information into this system. It sounds like it's going to be like hey, I'm Eric, and my transportation company is connected to my respite is connected to my, like, it's all, that type of stuff. That's what they want. They want to know the connections between the businesses. They want to make sure addresses are updated. And we're going to be required to receive and validate changes that you might make for that as well. Ethan asked, where can I find the information on the service codes crosswalk? It exists in the ether currently. We are awaiting for the finalization. We received a draft back in May of 2023. We received a notification in October of how many people might require transitions, but we haven't received the direction on how we're supposed to do it. Like, for example, do we need to revendor people, and what is that going to look like if we're changing service codes? What is the extent of documentation that, like, the DDS auditors are going to want to have on our end if we're going to be making those changes? Because that will impact it if we have hundreds of service providers that are going to require these changes during the time frames. So that's the service code transition that we're waiting for further guidance from the Department of Developmental Services on. Let's see here. Let me check in just real quickly. I didn't see if Michelle has anything from case management on that side. I know we're doing our coordinated future planning trainings next week. We're very excited about those kicking off again. We did a presentation on Tuesday to what was called the Olmsted Advisory Group, which is the Department of Health and Human Services, aging and caregiver group. I think I believe that's what the group is called. But I was able to do a presentation to them. Nancy Bargeman did a presentation, and then I had the opportunity to do one as well about our housing activities, and very exciting always to share about the things that are going on here. And one of the things that we always talk about when we talk about housing is our coordinated future planning initiative, and just the importance of making sure that during those planning team meetings that we are discussing, who is going to be the next caregiver that provides support, is the plan documented, making sure that we're getting that in the IPP. So looking forward to doing in-person trainings next Tuesday, and then the Tuesday after that for our staff at the Sacramento office. So yeah, Michelle, anything anything else?
Did you mention already about the community meeting?
I did, and I did
Okay,
mention that there's an agenda that has come out. So I think the way it's going to work out is that each of us we're each going to get a little bit of time to present, right, from the different, disciplines. Like clinical is going to do a piece, you guys are going to do a piece, then I'll do my piece, and we'll look forward to, that ongoing communication. It's going to be a quarterly type of thing where we're going to be able to connect with folks. And from PAC representatives, is there anything other than, of course, obviously we always plug the PAC meetings and want to encourage people to attend those, but anything else from the provider advisory committee meeting or provider advisory committee?
I'll put the
Sounds
next
like-
meeting info in the chat.
Thank you very much, Lindsay. And again, if you want to be up to date on advocacy activities as it relates to the state budget, that's the primary place where I think are going to be getting those updates, because they get the legislative updates at every single PAC meeting. And you do not have to be a PAC member to attend the PAC meetings. There is a hybrid option that is available for these meetings. Oh, I'm sorry. And then the provider advisory committee. That's one thing too. Every regional center, I think, has a little bit of a different name for those groups as well. But it is a requirement for our regional center, and it really does, support our board activities to be able to have that great connection with our provider advisory committee. Do we have any? I don't think we have any. We don't have any special guest speakers or anything, I don't think, for the next PAC. I don't think we do.
I don't think we do. I'm working on the agenda today, so I don't really remember what's on my list, but I think it's just our normal agenda, which, as you said, includes an update on legislative actions from various like councils. It'll include a report from Alta's executive director, Lori Benales. It usually includes information from community services, And then generally, we also discuss some sort of issue that's affecting service providers.
We always seem to have something to talk about. I don't know. I'm trying to remember the
Uh,
last time a provider advisory committee meeting like ended super early. Zach, how can I forget? We've received so far, I believe, 2 submissions for our Valentine's Day, right? For our Valentine's Day promotions. And I saw Beta on there, so I'm very happy because we know we support Beta's artwork, right? Most of us have a Beta original that's in our office. So please, Zach, if you could just drop in your chat again. I think we'll work with Leah to start getting those posted next week. We've got some beautiful baskets as well that I was able to take some pictures of that we are going to be able to promote too. So in the chat, Zach will put that in there. Please reach out to him because we want to be able to feature your artists that might be selling things between now and Valentine's Day. This is both for our staff that we want to promote that might want to buy things, but also we put it on our social media as well so people can contact you. All right, well, with that is what I have for today, unless we have any other questions in the chat, which I will check. Oh, there's detailed pack information in there, so please check that. And you don't have to register, I don't believe, for pack. You can just click the link and join the meeting. So and Lindsay's nodding her head, so perfect. And I think we'll even try to get the sound working before the meeting starts. That's our new challenge every time with our pack meeting, is figuring out our microphone situation. But
yeah, and you can also show up, come in person. We want to see you.
yeah, please. Again, it is nice to be. I mean, there were some people that started showing up in person for the first time since COVID, and so it is great to see folks at these meetings. All right, everyone, take care. Have a great weekend. We will look forward to talking to folks next week. And if you need anything, don't hesitate to reach out to your specialist. Thank you.